In southern Lebanon, more than 100,000 people were forced to leave their homes, their memories, their lives. Most of them suffer in silence, trauma, fear, and grief, in a country that barely recognizes their suffering. Since October 2023, families from border villages have been living in schools and temporary shelters, places that don't feel like home. Yet Lebanon still offers almost no mental health coverage, no national trauma program, no emergency hotline. Today, I want to talk about how war has magnified Lebanon's mental health crisis and what must be done to protect our people. Now, to grasp the true weight of this crisis, we need to understand what pushed thousands of Lebanese into this state of trauma. First, displacement. According to a UN report, continuous airstrikes destroyed homes, schools, hospitals, and farms. Entire villages emptied overnight. People lost their safety, their stability, their sense of normal life. Second, the economic collapse. According to the UN Agency of Refugees, even those who survived the bombing now face unemployment, poverty, and the loss of their livelihoods. Third, the collapse of the Lebanese healthcare system. According to the WHO, Lebanon has only 42 psychiatric beds per 100,000 patients. So imagine with me, only 4 beds for every 10,000 patients. Moreover, Lebanon suffers of a severe shortage in mental health specialists, and finally, no government-funded mental health support. So people has no other choice but to suffer silently with no system to catch them. Building on the causes discussed earlier, the ongoing conflict continues to have devastating effects on both adults and children. Adults facing continuous bombing that deprive them of their homes and safety are suffering from severe mental health challenges such as panic attack, disrupted sleep, and depression, as highlighted by the UNHCR Protection Brief 2024. Moreover, many of these adults are caregivers, meaning their psychosocial distress directly impacts family stability and the well-being of their children.
As for children, in particular, they bear a heavy burden. UNICEF reports that thousands of children are acutely distressed, displaying signs of separation anxiety and fear of loss. While a survey conducted by UNICEF in January 2025 found that 72 of the caregivers observed anxiety or nervousness in their children, and other 62% reported sadness or depression.
Building on the alarming mental health impact observed among adults and children, Lebanon must implement a comprehensive multi-level strategy to address these urgent needs. First, war-responsive mental health care is essential, as the WHO emphasizes mental health and psychosocial support (MHPSS) should be integrated into hospitals and the clinics to provide immediate psychological support for those affected by airstrikes and displacement. Second, mental health care must be adequately funded so therapy remains affordable for all families. The Lebanese Ministry of Public Health highlights that sustainable funding is crucial for ensuring access to vulnerable populations. Third, public clinics should be strengthened with every primary health care center offering mental health services. The WHO recommends integrating mental health into primary care to reach more people effectively, and deploying supervised university psychology students can help expand this capacity. Fourth, schools should provide mental support. Richter et al. Emphasizes the importance of school-based mental health programs and counselors to help children cope with trauma due to war and create a safe environment.
In the end, Lebanon has always survived devastation, but surviving is not enough anymore. Our people deserve to live, to breathe, to dream without fear. Every day, a child wakes up still trembling from the night before. Every day, a mother pretends she is fine so her children don't fall apart. Every day, a father carries the guilt for not being able to protect his family from the sky above. These are not headlines. These are human beings, our people. And healing them is not impossible. It starts with one decision: to care. To speak openly about the trauma instead of burying it. To demand mental health care as a right, not a privilege. To build a Lebanon where a child's biggest fear is school exams, not airstrikes. We owe this to every soul that suffered. We owe this to the martyrs. We owe this to the South, we owe this to ourselves. Lebanon can heal, but only if we choose to heal it.